Welcome back, everyone. Dr. Lawrence Cook is with us today from Lima Memorial Health System. Specifically, he's at the Ada Medical Center. We're talking a little bit today about our wellness visits and at the same time mental health concerns. If we do have mental health concerns, is that something we can start that conversation during those wellness visits?
Absolutely. That's actually the best time to start it. Well, when the patient comes in, we actually do an intake with the nursing staff, and they'll ask some basic questions. And then once the patient gets in the exam room, the primary care provider can expand on that and ask more directed questions. And hopefully the patient can open up, just like the patient would open up with really any medical concerns, physical or mental. So that's really the time to do that.
Yeah, I'm glad you brought that up because we all so often think, okay, well, wellness visit, that's purely for my physical concerns. But as you said, a wellness visit can also talk about our mental health concerns. What can a patient expect then if they do bring up mental health concerns in your office?
So again, conversation is the biggest thing, especially in the beginning. Again, just like physical concerns, for example, if somebody comes in with a knee problem, we're going to ask questions. When did it start? How severe is it? We'll ask the same questions for mental health. We want to know previous history. Has there been any other mental concerns, previous to this? Is there any treatments before this? And that way we can develop a plan with the patient on what we need to do.
And it's such a good point because you guys are in tune with all the other, the physicians out there, and especially those who deal with mental health concerns. As a primary care provider, is that kind of your next step, thinking, okay, where's the best place for this patient to go?
Well, absolutely. We have a lot to offer here at primary care as well. We treat an awful lot of patients for mental health concerns with medication and just talking to them. We also have the ability, of course, to refer to specialists if we need to. Again, just like if somebody has a bad knee, we send them to orthopedics. We can send a patient to psychiatry or psychology to also help us out. So.
Is there a problem, not a stigma is the wrong word, but for a patient coming in, if they do have mental health concerns, do sometimes they have to get past that stereotype that they're only there to take care of physical needs? Is that a hurdle they have to clear?
It is a hurdle. And in the past, it's been looked upon that way. And we try and open that up and make it very easy for patients to talk to us. Like I try to, tell the patient it is no different than a physical concern. So we treat, again, low backs, hypertension, diabetes, mental health, and we expect it to all be in the same arena. So, we're very open to conversations about this, and we do an awful lot of treatment on everything. So.
Yeah, and as you said, the first place to start is to come see you guys, right? And kind of get an evaluation of where to go from there.
Absolutely. I always tell people we treat probably 90% of our mental health concerns here in the office, and then we have that 10% group that we need to use specialists for, just like anything else.
All right, Dr. Cook, help is available as always. We appreciate you talking with us. Thanks so much.
Absolutely.
You bet. Nice chatting with you. We'll be back right after this.